Hello, I'm going to talk about the type of cancer I had, and it was breast cancer. It was found in its early stages. It was called DCIS, which stands for ductal carcinoma in situ. When I first got the news, it was very scary because I was hoping I wouldn't get that diagnosis. Uh, the process of this treatment was surgery, which was a lumpectomy with radiation. With the radiation, it was Monday through Friday for 6 weeks, which was a total of 33 treatments altogether. Let's see what else. Also, I took a pill called tamoxifen. Uh, I took that for 5 years, and this process or the cancer motivated me to keep up with my health and not to go more than a year without having a checkup, because that way, if it's something found, it could be found early and it can be treatable. I've been cured for this year, it'll be 7 years, and
You looked it up. Is that right?
I think cancer is abnormal cell growth and it spreads throughout the
What
body.
the cancers can you name?
Cancer. Primary cancer, leukemia, breast cancer, prostate cancer. Just say breast cancer. Colon cancer, lung cancer. That's it.
What is cancer, or what do you think cancer is?
You got little homies.
That nigga owe me money.
And then you got some grimy other little homies. The grimy little homies, they want to jump him because he looking too fresh, you know what I'm saying? He a stain. So look, the grimy little homies, they jump him. Now they winning. And they get a lot of them, it's a tumor in your brain. And then you know, maybe that's brain cancer.
How many cancers can you name?
Breast cancer, testicular cancer, pelvic cancer, lung cancer. That's it. I don't know. I forgot.
Do you have anyone that's related to you that has had cancer?
Yes, my grandma has breast cancer currently.
And is she going through treatment?
She went to treatment, but she's not doing anything as of now.
Is it like what is cancer? Like what forms cancer? Like how do you get it? Like that's my question.
Shit, I feel like sun causes cancer.
The sun?
Yeah. That's what they say, right?
What is cancer to you?
Death.
You just think cancer's you gonna die if you get it?
It's deadly, yeah. There's no cure for cancer.
So you think it's dead game as soon as you get it?
Yeah. Because even if you get cured, it's gonna come back.
No. Cancer to you?
My coach told me I was a cancer one time. I believe that a cancer is something that infests something that's flowing normally or working and just destroys the whole thing.
Cancer is a disease that spreads throughout the body. It's very vigorous, whatever.
Cancer is a group of more than 30 malignant diseases that are characterized by abnormal cell growth with the ability to locally invade and spread to other parts of the body. It is a disease of tissue growth regulation. That is to say, the factors that cause cell growth are stuck in the on position, while the factors that retard abnormal cell growth are stuck in the off position. These changes appear to be associated or preceded by cellular changes within the cell that promote cell growth and retard the immune surveillance system. About 1/4 of all cancers are related to smoking or tobacco products. Another 10% are associated with poor diet, obesity, sedentary lifestyle, and alcohol consumption. Another 20% appear to be related to infection, while the remaining appear to be related to other environmental factors. And there is a small percentage that appear to be associated with genetic predisposition. In other words, cancers that seem to run in families. About 15% of all deaths annually are cancer related. While there are certainly pediatric cancers, cancer is considered a disease of aging. In other words, the older you get, the greater your chance of developing a cancer. Cancer is detected through investigative means and blood tests. Oftentimes, cancer is first suspected due to signs and symptoms. Symptoms can be related to the mass effect of cancer. In other words, the enlarged tissue is either visible or pushing against other organs, causing problems. Sometimes it is preceded by what we call systemic effects: weight loss, loss of appetite, general malaise, which is just feeling poorly. Cancers are also found through investigative efforts such as direct visualization, that is, looking into the esophagus for a person who's having difficulty swallowing, looking into the colon for a person who has developed an unusual constipation, looking into the bladder to a person who is now urinating blood. Biopsies are performed, which is obtaining a piece of the tissue that is examined under microscopic evaluation for identification of the abnormal cells and their origin. Cancer treatments are traditionally surgery, that is just removal of the cancerous tissue, hopefully prior to its spread through the lymphatic system and lymph nodes or spread through the blood. Chemotherapy, which is the use of medications which are designed to affect the growth of cancerous tissues while minimally affecting the growth of normal human tissues. And radiation, which is the delivery of radiation to the body part that is affected by cancer with effort to affect normal surrounding tissues minimally. The newer horizons on treatment cancer are quite exciting. They are directed at those genetic changes which cause gene expressions and disrupting those gene expressions. The newest thing on the horizon, which is quite exciting, is the use of known viruses. Viruses such as the common cold, viruses such as polio, even HIV viruses, which have been attenuated that will not cause disease. These viruses get into cancer cells and appear to cause a genetic modulation which cancels cancer's ability to grow and makes that cancer recognizable
All right, this is Jordan Creel. We're gonna ask her some questions about cancer. How many people do you know in your family that have had cancer?
Probably like 5.
And how many live?
1.
And the others, do you know what type of cancer that they had?
My grandpa had bone cancer. My Mimo had esophagus cancer. My aunt had breast cancer. And there's a couple distant family members.
They just had like random different types of
Yeah.
cancers, just found lumps or something?
I don't know. It's when I was little.
Oh, okay. So how did do you know any of the procedures that those family members had to do while they had their cancers?
They had to go through chemo and radiation.
Did any of them take any pills that you know of?
Yeah, they were on a lot of medicine.
So how did their cancers affect you?
Well, my Mimo, she was the first person I was around. I wasn't around her a lot because they flew her out to Texas, and I'm from Georgia. So I lived with her a lot, so it was just different not having her there.
Because she was going back and forth from Texas to do her radiology?
No, after she found out she had cancer, they permanently flew her out but her hospital was in Texas.
Okay, and how did this affect your family, like all this traveling and moving?
Yeah, each family member pretty much right before she passed away, we would fly out and spend 2 weeks with her, each family, different family.
Hi, my name is Tiana Humphrey. Myself and a group of cancer specialists created the Cure-All drug. It kills all cancer cells throughout the body and helps you develop healthier cells. It has a few symptoms such as lightheadedness, bloody stool, difficulty thinking, and pale skin. I have with me Valerie Cortez, who is now participating in taking the Cure-All drug. Hi, Valerie.
Hello.
What type of cancer are you affected by?
I had lung cancer.
And what made you take this drug, and how did you find out about it?
Well, a lot of my family members have experienced cancer, so I decided to act fast on it because my doctor recommended this drug, so he said it was good and that it would work fast.
And how many family members have been affected by cancer that you know of?
4 that I know of. My uncle, one of my aunts, my grandmother, and my great-grandmother.
And how many survived?
My uncle, my grandmother survived. My aunt and my great-grandmother passed away.
And did this affect you in any way?
Well, my aunt was very recent, so I think that one really hit close to home. I was really close with her. I grew up with her, so.
And has this drug affected you? Has it killed all the cancer cells in your body?
Currently, I have no signs of cancer, so yes, it works.
What symptoms have you faced with taking this drug?
I've had some weakness, and I've had random chills.
And how does this affect you throughout your daily life?
With the weakness, when at random times it's hard for me to get up, or my body feels like it's heavy. And then for the chills, at random times I just get chills, and I'm very cold, and I feel like I cannot get warm.
Thank you very much, Valerie, for sharing your experience and taking the Cure-All drug. I have Kaylin Thompson, who is also going to share her experience with the Cure-All drug. What type of cancer did you have?
I had cervical cancer.
And how did you find out about this drug?
My grandma also suffered from cervical cancer, so she recommended it to me because it helped cure all the cancer cells in her body, so I thought I'd give it a try.
And has it worked?
Definitely. I have no more cancer cells. I'm cancer-free. I feel great.
What symptoms have affected you from taking this drug?
I'm taking Cure-All. I've suffered from lightheadedness, and I have difficulty thinking. When I wake up in the morning, sometimes it takes me a little bit longer to get up because as soon as I wake up, I get really dizzy, and it's hard for me to see the room because it's fuzzy. And then in school, I have trouble thinking and concentrating in class. I don't listen to the teacher because the drug has very bad side effects.
And do these side effects happen every day?
I wouldn't say every day. I'd say probably 4 times a week. It definitely affects my daily routine though.
Do you have any more family members that have been affected by cancer at all and that you would recommend this drug to?
Recently, my grandfather did pass away from cancer, so I wish he would have used the cure-all drug and found out about it sooner so that he could be here with me. Other than that, I'm lucky to have no other family members with cancer.
Okay, thank you for sharing your experience with the cure-all drug.
You're welcome.